The concept of sexual health in the context of injury, of pain, of disability. So many of our wounded American soldiers, Marines, other service members have been struck by the signature wound of the war, PTSD and TBI, which is caused by the signature weapon of the war, which is a blast. And one thing that many people don't realize is, what does a blast do? Well, it causes multiple wounds, to include usually lower leg amputations, but it may be upper extremity, to include genitourinary injuries, hearing loss from your eardrums being disrupted, and then, of course, TBI and PTSD. And there's been a lot of focus on PTSD and TBI, and that's appropriate. But now what we're really looking at is, how can we help our wounded service members retain, regain intimacy and sexual health in the context of often severe disfiguring injuries. It is clearly a difference when you're talking to females and men, especially when you're talking about disfiguring injuries or amputations. Men are usually very concerned about whether or not they're going to be able to function sexually, and sexual potency can be related either to a physical problem or post-traumatic stress disorder is treated with selective serotonin reuptake inhibitors, which cause sexual problems in many individuals, and traumatic brain injury causes endocrine problems, which also causes sexual problems. Women have the same issues, but slightly different. Obviously, they don't have penises, genitalia the same way, but they can certainly be concerned about their reproductive function. Women who are in the military are usually of reproductive age, so pregnancy, childbearing, attractiveness is very important. And then for mothers who are wounded, there's often a question, will I be able to continue to function as a mother, say, with only one arm? First of all, just about all psychiatric medications have some impact on sexual functioning. It's well known that the SSRIs, selective serotonin reuptake inhibitors, which is what we're using for post-traumatic stress disorder by and large, cause problems with erection, erectile dysfunction, ejaculation. And part of the strategy around these is just to talk to the patient about it. But then you can also add either a medication like bupropion, Wellbutrin, which helps reverse sexual dysfunction, or you can add a phosphodiesterase inhibitor. That's a medication like Viagra or Cialis, and that can be very helpful. Another area is pain. If people are in pain, they're not going to be able to function very well with any aspect of intimacy. So you want to be able to treat the pain. Having said that, opiates, which are often used, cause real problems with the ability to achieve an erection. And the most important part of this, in all of this, is to ask your patient about their sexual health and functioning, and then have a reasoned discussion about which medications to use and why. You know, we've been used to think about erectile dysfunction really with the older population, older men, so it may be new to bring up the question with a 22-year-old. But I'll tell you, if the 22-year-old Marine is having sexual problems because of the antidepressants they're on, they're not going to stay on the antidepressant unless you've talked to them about it and said, these are some of the other strategies you can use.